Good afternoon. Today is Thursday, November 7th. This is the Joint Education, Culture, Health, and Human Services Committee, where we're going to be hearing critical updates on early care and education. We will afterwards have a triple committee, because this is such an important issue and took a lot of our time during the budget and last year to discuss the progress and what we want to see for all of our young learners and young children in that whole system. And this is the first time we've met to talk about it since May, since the budget. So we're back to do that. I do want to say, since I believe this might be the first council session since the election.
We had one this morning.
Okay, they had one this morning. Wow, first one I've been in. I'll just say I want to thank all the residents who came out and voted here in Maryland and Montgomery County and participated. I know I'm sure I speak for my colleagues. We are very focused on how we can do what we need to do here in Montgomery County and in the state of Maryland to make sure all of our residents have what they need and are protected. Maryland was certainly a bright spot for many of us. And so early care and education is a part of that, and how we take care of our youngest and make sure they can have what they need to become thriving adults and their families. Want to make sure that we just emphasize that we see it as our job to keep all of our residents safe. So one more thing I would love to just point out, since this is we have mental health resources available in our county. Every Mind hotline, since we have HHS here, it's 301-738-2255, or you can text the same number, 301-738-2255, if you're dealing with any issues, which I know many are. As I mentioned today, we're going to have an update on our early care and education system, and very excitingly, the much anticipated studies related to supply and demand and the cost of care. Two of the three, I know we're still waiting for the workforce one, but we're going to touch on that in the triple committee. And there's a lot to discuss. I would ask, since we have a hard time stop at 4:30 for both committees, that we'd like to get to the presentations, both of them at the same time, back to back, and then we'll turn to questions from colleagues. And this is a topic that we could talk about for hours, but we're going to focus this session on these two studies, which are integral to the whole system: cost of care and supply and demand. So with that, I'm going to not read the rest of the things they wanted me to read here. And I'm going to pause and turn. I know, because we have Dr. Bridges, I think you wanted to make a couple comments before we got into the presentations.
Good afternoon, EC Chair Jawando, HHS Chair Albanos, ECON Chair Fanny Gonzalez. I wanted to say that today's watchword is resilience. And so we have a cadre of dedicated professionals and staff who will present strategies not only on the ECEI, but how we move forward in the early child care arena, if you will. We've begun to do some studies on the next generation of early learners, Generation Alpha. And so we look at demand study, the cost of care, and then even strengthening partnerships with our Children's Opportunity Alliance, which you will hear later on in the day. So we look forward to a robust conversation. I'm not going to say much. The team told me to keep it to 1 minute. So that's it. That's my 1 minute, 30,000 foot overview, because we have a host of speakers who will provide a robust discussion this afternoon. Thank you.
Thank you, Dr. Bridges. Resilience, that is a very good one. All right, so I'm going to turn it over. If you could just introduce yourselves, or you can introduce the team. And then Ms. Yao, anything to add before I turn it over? Okay, let's dive in.
All right, good afternoon. Jennifer Aranais, Senior Administrator for Early Childhood Services, DHHS, and very excited to be able to present today the overview of both of the studies that we've been long waiting for. To my left, we have Jacob Roche from Reinvestment Fund, who will review the supply and demand study with us, and then we'll follow with Andrew Brodsky from Brodsky Research and Consulting to give us the overview of the cost of quality childcare. So I'm going to hand it over right away so we can get into it. Jacob.
Wonderful. Thank you.
Great. All right, everyone. I'm Jacob Roche. I'm a senior policy analyst with the Reinvestment Fund.
You have a presentation that needs to come up?
Yeah.
Okay. Okay.
Do we have the slides? Oh. Oh, just. Are they gonna? There we go. Okay. All right. So, as Jennifer mentioned, so I'm going to give an overview of our findings from the supply and demand study. Why don't we go to the next slide? Great. So this is just a little bit about us. As I said, I work with an organization called the Reinvestment Fund. We're a CDFI, Community Development Financial Institution. If you're familiar with CDFIs, I like to describe it as like a bank with a public purpose. So I work for a small team in the organization called Policy Solutions. We're researchers and consultants, and we help our lenders kind of understand the markets and the places where we're making loans and grants. And we also get to work with communities like yours to do that same kind of work. So the study that we did for Montgomery County is very much based on the kinds of studies we do to inform our own work in early childhood education. Let me jump to the next slide. This is just a little bit about kind of our work in that area. We, on our sort of lending and grant making side, we manage facilities funds, quality improvement grants in different cities, and all of that work is guided by the same kind of supply and demand analysis that we did for Montgomery County. And you can see some of the cities where we've done that. So let's go to the next slide. And we can just dive right into it. So I thought today I'd give you kind of a high-level overview of our findings. So I'll say a little bit about demand, supply, shortages, some of the themes from our interviews and focus groups with parents and providers, and then end with some recommendation and observations about how to use the data that we found. So I'm not going to get too into kind of methodology today, but that'll be in the longer report that you all get. So starting with demand, this is sort of where we start our study. As I said, I'm not going to get too deep into the sort of methodology, but just to say our estimates of demand for childcare, we start with population estimates. So the data that you're going to see in the study come from, we wanted to get the most sort of up-to-date data that we could, which means, we're not relying on census estimates, which usually have a couple-year lag. So since our supply data is from 2014, we wanted to get population data from 2014. So we purchased population data from a company called Claritas. And then we take those population estimates and then we adjust them based on commuting patterns, because we know, although most parents look for childcare near their home, there are many families that look for care near where they work or on the way to work. And so when I present to you kind of our demand estimates, where we think demand is located in the county, it accounts for both where people live, but also where they work. So let's get right into it. So what you see on the slide up here are, on the left, some of the characteristics of families of young children in Montgomery County that we think are going to influence how and where people look for childcare. So I'll just point out a couple numbers that I think kind of jump out to me. The first is 74% of kids, 74% of children under 5 who are childcare age live in a household where both their parents are working. So these are families that might not be using formal licensed care, but they're certainly going to need some form of childcare. 39% of families have at least one parent that's working in some sort of hybrid or fully online environment. So again, they probably still need some form of childcare while they're working, but where they're going to look for it is going to be influenced by that. Income, 38% of children in Montgomery County qualify for CCS based on their family income, and we estimate about 55% of all kids in Montgomery County are eligible for either WPA or CCS.
Could you just explain what CCS is?
Sure. Child Care
for
Scholarship.
People watching. Yeah.
So and WPA. These are both programs that help families afford the cost. There we go. So yeah, CCS, the Child Care Scholarship, and WPA, Working Parents Assistance, are both programs that help families in Montgomery County afford the cost of childcare. So about 55% of kids in the county are eligible for one of those programs based on their family income. And then, two other things about kind of the workforce in the county. 21% of kids have at least one parent that works non-traditional hours. So they leave for work before 6 a.m. or after 6 p.m. So these are kids that if they're using a licensed childcare setting, they probably need, extended hour care, maybe weekend care. And then 58% of kids who have at least one parent that speaks a language other than English at home. So again, families that, might be looking for certain characteristics in a childcare program. So getting right down to the numbers, so the right side of your screen there has our estimates for sort of overall demand for care in Montgomery County. Overall, we estimate there's about 57,300 children who might be looking for care in the county. And you can see on the screen there how that breaks down by age. A couple other kind of segments of the market we thought were important to point out. So I mentioned about 55% of kids are eligible for one of those subsidy programs, WPA or CCS. That translates into about 32,000 children in the county. About 12,000 kids, have one of those parents who has one of those non-traditional work schedules, and about 33,000 kids have a parent that's a non-English speaker. So let's jump to the next slide. This is a map of where we think demand is kind of concentrated in the county. So sort of along the 270 corridor, there's kind of some hotspots there. So let's go to the next slide. And now this is shifting into supply. So just a note about, again, kind of our approach here. When we are measuring the supply of childcare, we don't want to just capture publicly funded seats or just licensed centers or homes. We want to capture as much of the sort of market for out-of-home formal childcare as we could. So you can see on the left side of your screen some of the data sources we use to get at kind of all the different types of childcare programs that exist. And when we found all those programs and we estimated their capacity, our estimate is that countywide there's a capacity for about 33,600 children. And you can see how that breaks down by age. So about 4,300 of those seats are for infants and toddlers, which means kids under the age of 2. And about 29,000 of those seats are for preschool age children, so that would be age 2 through 5. Of the 33,000 seats in the county overall, only about 12,000 are in highly rated programs. Those would be programs that have an Excels rating of 3 or higher. And I think as we get to the cost of care study, you'll see that that those high ratings are really important, not only because it indicates their higher quality education, but it's also important for kind of the business model of childcare programs. There's about a little less than 5,000 seats in programs that have non-English speakers on staff. This is self-reported data, but gives kind of a sense of sort of language access in the county's childcare market. And only 500 seats are in programs that offer evening or weekend care. Great. So, one of the sort of pieces we really wanted to understand was access to affordable care. That's one of the things we heard over and over again from parents is the affordability of care is really important. So really the county's kind of lever to impact affordability is through the different subsidy programs that are run by the state, by the county. And so what you see on the left side of your screen is a breakdown of kind of different types of subsidized care in the county and our estimate of the capacity in programs that participate in these subsidies. So there's about, we look at all the programs that participate in WPA, there's about 9,200 seats in those programs. Programs that are eligible to participate in CCS, that's the state subsidy program, there's about 21,000 seats there. 3,200 seats in school-based pre-K. You can see the number for special education and community-based pre-K there. If you add all that up, and there's some duplication, some programs are in, some sites are in, but all of them, so those numbers don't fully add up. But if you add all of that up, what we estimate is that across the county, there's about 26,700 seats in these subsidized programs. And you can see on that slide kind of how they break down by age. So, one thing that really jumped out to us is the county's subsidized seats are really concentrated in that preschool age segment. So there's about 22,000 preschool age subsidized seats, but only about a little less than 3,000 subsidized seats for infants and toddlers. One other point on this is if we look at the sort of capacity in these programs, we compare it to how they're being used, we can see that the county's really sort of underutilizing the subsidized capacity that it has. So as I said, we estimate there's 21,000 or so seats in programs that are eligible to participate in CCS, but there's only about 4,000 kids actually using those seats. There's 9,200 seats in programs that participate in WPA, but only about 940 kids in those programs. So the county has a lot more sort of unused capacity in these subsidies programs. And again, when we get to the conversation about business model, we'll see how these subsidized programs are not only really good for parents because it can help them afford care, but also can be really good and important for a provider's business model. So this is a map of where the capacity in the county is located. So those darker areas, that's where we see higher numbers of seats in childcare, lighter areas, less capacity. Great. So we talked about demand, we talked about supply, we put those together, that's how we come up with our estimates of shortages. So let's go to the next slide. So what you see on the left is kind of just a summary of what we saw before. So overall, we estimate there's about 57,000 kids, there's about 33,000 seats. Put those together, that means there's a gap of 23,000 seats. And the way I like to look at this is kind of that column in the far right, supply ratio. This is basically dividing supply by demand. So when you do that, what you see is overall, sort of at all ages, the county has enough capacity for about 59% of children under 5. And on the right side of the screen, you can see how that compares to some of the other communities where we've kind of recently done this work. So, the county has more capacity than the state of Rhode Island, which really doesn't have enough childcare programs, but less than some other areas like Atlanta or DC. But I think the other thing to point out here is that, the overall gap is really masking some kind of important variation. So if we look at the sort of preschool segment of the market, really that's a pretty well-served segment. So the county has enough capacity for about 83% of the kids ages 2 through 5, but only enough capacity for 19%, just under 20% of infants and toddlers, meaning kids under the age of 2. All right, so that was sort of overall supply and demand and gap. What this map here shows is where those gaps are located. And this measure is one that we use a lot in our work. We call this our relative shortage. Essentially what we're doing here is we're looking at where gaps are largest within the county. So, we know not every family uses childcare. Unlike sort of K-12 where education is compulsory, not every family is going to use childcare. So what we do with this map is we say, okay, what's sort of the typical relationship between supply and demand? On average, how many seats are there for every kid or kids for every seat? And then where is that relationship really far off, above or below? So, if on average there's, let's say, 3 kids for every seat in Montgomery County, this map shows you where there's 10 kids for every seat or 20 kids for every seat, right? That's where there's a really large gap relative to the rest of the county.
And the orange is the gap is the biggest.
That's correct. So the orange colors are where we have the largest gaps. The purple areas are where those gaps are smaller. Doesn't mean there's necessarily a surplus in those places because overall there's a gap between supply and demand, but that's where the gap is smaller than sort of average. So this is overall care. If we go to the next slide, you'll see this same sort of shortage measure, but just looking at infant and toddler care. So if we could actually just go back one. Is it possible to go back? Oh, that's fine. That's fine. Yeah, so you can see there's some similar locations, but there's also a couple of differences in where we see shortages overall and shortages of infant and toddler care. All right, so let's now let's go.
What was the second slide again? You'll go back
So
one
that was
bit.
the shortage just of infant and toddler care.
Infant and toddler.
Yeah.
Which is the one that has the most shortage already.
Correct.
Yeah. Okay.
Correct. So these two maps look really complicated, but I promise there's sort of a simple message behind it. So the map on the left, let's start there. So what this is showing is those shortages kind of overlaid with the demographics in the county. So those yellow areas are places that are predominantly white. Blue are areas where the population is predominantly black. Purple would be predominantly Hispanic, et cetera. And the intensity of the color on that map indicates how large of a shortage it is. So darker colors mean larger shortage. The point is there's sort of all the colors on the map that you can imagine, right? So what that means is that the large shortages in childcare really affect every type of community in Montgomery County. We've got large shortages in.
I'm sorry, is that shortage? I apologize. Is that a shortage by like percentage of population or by number of seats?
Just looking at number of seats. So a dark yellow place would be a place that has a large shortage and then also happens to be predominantly white. The purple area would be, the dark purple would be large shortage and predominantly Asian.
Thanks.
Yeah. And the map on the right is the same idea, but looking at household income. So again, you see kind of all the colors. Dark orange, which are large shortages affecting lower income communities, blue, large shortages affecting moderate income communities, and then the sort of dark gray, large shortages affecting high income communities. So the childcare shortages that we're measuring, really are affecting kind of every community in Montgomery County. So I showed you some estimates of supply and demand for those, affordable subsidized seats. So this is kind of putting that back together here. So the first column you see is the number of children that we estimate in the county who live in families that are eligible for those subsidy programs, CCS and WPA. And then the second column shows the total number of seats in programs that either participate or could participate in one of those subsidy programs. So 32,000 kids, 21,000 seats, it's a gap of about 10,000. Or put another way, the county has enough subsidized seats to serve about 68% of kids. And again, when you break that down by age, you can see the sort of preschool age range is much better served than infants and toddlers, where there's only enough subsidized seats for about 1/4 of kids. And I'll just point out, as that kind of scary red box shows, this is all kind of best case scenario, meaning, not every program that's eligible to participate in the subsidy program does. And, most programs don't only serve subsidized children, they'll serve a mix. So these numbers are all assuming every program that's eligible participates, and every program sort of fills up all its seats with subsidized kids. So again, I just want to caution, these numbers are kind of best case scenario levels of service. So I've been mostly presenting on kind of our quantitative findings, but if we jump to the next slide, we also did some sort of qualitative work to understand the perspectives of parents and families, and also the providers that are in Montgomery County. So we did a survey of families. We did some focus groups to follow up with that. We did a survey of providers, and again, focus groups with providers. And I just sort of highlighted kind of 4 themes that came out of that, but there's a lot more we learned that's going to be in the report. But just to highlight those, so in our conversations with families and parents, what we heard is affordability of care is really driving a lot of parents' decision making around childcare. So what they can afford and is really a key driver for them. The hours that programs have, the location, those are also important factors that they're looking at, but really affordability is the biggest thing. And I think that quote we pulled out there on the right side of your screen, which is from one of the parents we spoke with, to me kind of encapsulates sort of the themes that we heard from families. What he told us, this one parent is, if you look hard enough, you can find a program, but it might not be the best quality, not the situation you want. In that case, he was talking about hours, but you can find something. The question is it affordable enough? And that's, I think, the struggle parents are facing. And I'll just point out one more thing we heard is, when we spoke with families, there are a lot of kind of information gaps. So parents generally told us, I can go on Google and I can find a program near my house. I know how to do that. I know how to search for a program and find one. But they didn't necessarily know how to enroll in it, or they didn't know that there were resources available to help them pay for those programs, or what the different types of programs meant, what quality meant. So kind of understanding the system, there was some system sort of information and understanding gaps. And that was particularly true for the immigrant and non-English speaking parents that we spoke with. On the provider side, just very quickly, particularly in the most competitive parts of the county, providers are really, struggling to fill their enrollments. When we asked providers, do you think your business is financially stable? About a third told us, yes, it is. About a third told us sometimes, and about a third told us, no, it's not financially stable. So, providers on average are struggling, but they're optimistic about the future. Many of them want to expand. And, when we asked them, do you think you're going to be open next year? Pretty much they all said yes, because they do really care about this. And so they're struggling. They want to expand. They want to serve more families, but they lack the sort of resources and access to grants and loans that they need to sort of grow their programs and make investments in their business. So I thought I would just conclude with a couple kind of recommendations about how to use this supply and demand data. In the report, we've got some recommendations focused on, how to sort of get access to data to make the kind of supply and demand study we did a little easier for you all to update in the future. We have some recommendations around those information gaps that families face, and some recommendations around barriers to accessing the subsidy program from our conversations with parents and providers. But wanted to focus today on sort of the supply building recommendations we have. So there are 3 sort of observations, 3 findings we had about your market that I think inform the way you'd want to use this data to address the gaps in care that exist. So the first is, childcare in Montgomery County and really everywhere else, it's a competitive consumer-driven market. So there are parts of the county that are well served with childcare, and in those places, creating new programs, adding a bunch of new seats, that's not going to be sustainable, right? You really want to try to think about the geographic component of supply and demand when you're, looking to address these gaps. Second observation is that the county's gaps in childcare really are in sort of specific geographic and market segments. So I mentioned infant and toddler care is a big gap in supply and demand, the supply of subsidized care, and the supply of high quality care. Those are the kind of segments that I think you really want to try to focus on with the resources and tools that you have. And then finally, providers are interested in expanding their programs. They want to add more services that families want. They want to improve their quality, but they lack the resources to do that. So you want to think about how you can use, the policy levers that you have to incentivize the kind of growth that you need in the areas that you need it. So the data that we've given you, our relative shortage maps, our absolute shortage numbers, they can really help kind of guide that. And so if you go to the next slide, this is just a little bit about kind of how we think about doing that in our own work. So, one of the nice things about Montgomery County is your ECS department kind of has all the tools in its toolbox that it needs, right? It's got programs to help providers start new programs, expand existing programs, improve the quality of programs. What you want to do is use the supply and demand data that we've given you, the shortage information, to think about how to target that. So how to match the conditions in the market with the tools that you have. So if we go to the next slide, this is just one example of how you would do that if your goal was increasing access to infant and toddler care. So what you see on the left side of the screen is kind of like two axes. What I've done is just overlaid that shortage map of all care and the shortage map of infant and toddler care. And when you put those together, you can kind of start to see how you would match different tools to different types of markets. So the places on that map that are red, those are places where you don't really have enough programs to serve families, and the programs that do exist don't offer enough infant and toddler care. So those are places where you'd want to focus on, creating new programs to sort of meet the demand in the market. Purple areas are where, again, there's an overall shortage of supply, but the providers that exist are serving infants and toddlers. They've kind of figured out that business model. So that would be a great place to think about program expansion, right? Helping those providers replicate their programs or grow the programs they already have. And then the light blue places in the map are places where overall there's enough supply, but the providers that exist aren't offering infant and toddler seats or enough of them. So that's where you'd want to work with them to think about how to adjust their business model, how to add a new classroom that serves infant and toddlers, that kind of work. The gray areas, according to our measure, kind of have a typical level of both overall supply and infant and toddler supply. It's not that you wouldn't work there, but I would prioritize your resources and tools in these other types of markets. So if we go to the next slide, this is that same sort of concept, but now looking at access to affordable care. So the y-axis on that thing on the left, the graph on the left, is overall supply. The x-axis would be the sort of access to subsidized supply. And then if we go to the next slide, same idea, but looking at high quality or highly rated programs in the county. So where do we have a good amount of supply overall, but maybe that supply isn't highly rated or not participating in the rating program. So let me end there, and I think if we go to the next slide.
So now if we can go to the next
Great.
presentation for
Thank you. Yeah, we'll
Andrew
hold our
will lead
questions.
cost of care.
And just hit your mic in front of you there. There you go.
Hi, I'm Andrew Brodsky. I'm the president of Brodsky Research and Consulting, and we're an early childhood research firm. We've worked in 17 states around the country, and we specialize particularly in estimating the cost of care and helping more children and families access care. I just want to take a minute to thank you all so much for inviting us to partner with you, do research, and help build the early childhood system and present our results today. So what is a child care cost model? It helps us understand what the business model for a provider is and how providers can stay in business. How can we support providers and families managing what it really takes to run a child care? And we also want to look at what the gaps are between what the current costs are for a provider to actually cover care, and then what their revenue streams are. And this all will help us inform what subsidy rates are, how much support families and children need. So figuring out subsidy costs, so the costs that like public funding, how much public funding families need, there's a sort of wave around the nation of using these cost of care models rather than the current market or tuition rates that parents pay. So often the amount that parents pay is too low. So providers have trouble staying in business using the current tuition revenue. And so a number of states have used this new alternative methodology of using the actual cost of care. So we're really on the forefront here of using this sort of like state-of-the-art method to really understand what we need to do to support families. So today I'll talk briefly about how we approached the work and what data we used, and a little bit about the design of our cost model. Then we'll talk a bit about about our findings. So the purpose here was to understand what are the costs of care in the county and how do they vary. So how do they vary by different ages of child? and how do they vary by different quality levels of provider. Then we want to look at what those costs are. So what does the business model for provider look like, and how much does it actually cost them to run their business compared with what they might receive from parent tuition and also from these different subsidies. So Jacob had mentioned the state child care subsidy and WPA. So we want to know, are the providers actually able to support truly delivering care, and what would they, if not, what would they need in order to be able to do that? Then we finally have some findings and recommendations about what we can do in the county to support the sustainability of business models and ensure that all children and families are really getting the quality childcare that they need. So quickly, we have a cost model that we customized for Montgomery County, and this is the state-of-the-art model. We also, it originated with the U.S. Office of Child Care. It's called the Provider Cost of Quality Model, which is what the federal government uses. So we were involved back then in developing this model, and this is an offshoot of that. So it's been used in a number of states and the federal government, and it is probably the most detailed cost model that we know to really estimate what the costs are under different scenarios. We partnered with the Reinvestment Fund to survey Montgomery County providers. And so our portion of that was some detailed questions about their costs so we could better understand what's really happening in the county. In addition to that, we conducted focus groups and interviews with stakeholders, families and providers, and other community members in the early child community. And in addition to that, secondary data collection. So we really understood who's in the county, what is the population, where do people live, what are the real costs. So what are housing costs, what are utility costs, all those different pieces that comprise running a business, like a child care provider. And with an eye towards Excels, which is our quality rating system. So really understanding like what it costs to run a high quality site. So a bit more about the cost model itself. So we've captured the critical personnel costs. So that is the human beings who are employed in the site, the teachers and assistants and administrators, and how do we pay them? In addition to the non-personnel costs, which are all the other pieces, like the facility costs, the utilities, the things children need to learn, materials, all those pieces. And again, all these are applied using the latest data that we have for Montgomery County and the quality requirements that, again, are from the Excels program. We also include the costs for some of the pieces that are specific to a child care provider. So, for example, staff turnover is a really significant issue in the field. So providers, child care teachers typically have low wages, so it can be harder to recruit and retain them. And this has implications for the whole workforce in the county. And so we want to include those costs. The enrollment efficiency means how many kids you can actually have at one time in your center. How well are you able to fill up those seats? Are you able to collect revenue from all of the parents? In some cases, it can be hard to completely collect all that revenue, and other dynamics that are just part of running a child care center or a child care family home. And again, we created two models. One is for the center model, and one is for family homes, which operate, the structure obviously is slightly different, so we created two separate models. So a couple of really important notes here about how to interpret the results when we get there. So we modeled one particular baseline scenario. So our model allows us to model any number of types of providers by changing different assumptions about how many children there are, what ages, and so forth. So what we're going to show you is one particular example provider. So just keep that in mind as we're walking through. We use a particular revenue mix, which means we're assuming that a particular percentage of children are receiving subsidies or are paying on their own. And again, that can change. Every provider is different, again, depending on like where you are in the county, what types of children you serve, what your business model is. And so we just want to emphasize that these results, as you'll see, are sensitive to changes in assumptions. So there's not just one number that is the cost to provide care, but it depends on a lot of assumptions. And we'll talk through what happens when we change those assumptions and what that really means for the cost. So now we'll talk about how the cost varies by the child care quality and the child's age. Yeah, you can go on. So again, this is our typical provider. There's a range of providers, but this is sort of in the middle. So this represents a typically sized provider, although there are larger ones, there are smaller ones. It has about 67 kids in 5 classrooms of all different ages, from babies to preschoolers. It uses the requirements for how many teachers need to be in, and staff need to be in a classroom, depending on the age. So younger ages, we need more adults per child. And then on older ages, like preschoolers, not as many adults are needed per child. We're using the current wages. So the market wages mean what do teachers actually get paid in the current environment. It's not necessarily for these numbers what we think they should get paid or what it would cost to keep them retained, but it's what do they actually get paid. And then in this particular scenario, most of the children would pay on their own. And that reflects the reality around the county. As you just saw, the relatively few children are receiving subsidy, and there are many more children who are eligible for subsidy than actually there are funds for them to use it. So in fact, most families are paying full tuition. A small number of them do receive the state subsidy, and some receive the local working parents assistance subsidy. So here are our sort of top line numbers for this example provider. You'll see younger children on the left, older children on the right, and these bars represent increased quality levels. So you can see first that the cost for a family to send their kid to childcare is exorbitant. So for a baby or a toddler, at the middle level of quality, it's $26,000 a year. And so you can imagine like what the impact is on a middle income or lower income family. We can see that it costs significantly more for younger children, largely because they need more staff. And for 3 and 4 year olds, for preschoolers, it's less, but it's still expensive, between $13,000 and almost $17,000 a year to send your child to full day preschool. Yeah. What's that? Oh, I'm sorry, did I skip one? Oh, I apologize. Oh, sorry, I didn't see you'd flipped it. So we did the same thing for homes. And for homes, home models are a little bit different because typically all the children are in one room with one provider, sometimes with an assistant. So we separated the ages a little bit differently. But you can see that even in a family home, the costs are still very expensive, up to $23,000 or so for an infant or a toddler, up to $15,000 for preschoolers. I'll note that they home costs do tend to be a little bit lower. You don't have the same overhead that you have in centers, and there's some different regulations for various reasons for running a home. So there are some savings, but it's still quite expensive. So now we'll compare what these costs are, what providers really need in order to run a childcare business, with what they might receive from tuition and from childcare subsidy revenue. So what you see in the blue, dark blue with the red outline is basically the number that you just saw, what an average cost of care is to provide care. It's about $21,000 for toddlers, infants and toddlers, about $14,000 for preschoolers. This is averaged across all types of quality levels. Or this is for a level 3. This is kind of middle quality level. But what we see is that so now we're comparing that to what they might receive from different types of subsidy funding. So we see that the WPA funding is lower than the provider needs. The child care subsidy can be a little bit higher, and the EquiCare grant, which is only for infants and toddlers, is higher, but it's only higher because it's on the backs of those teachers and substitute teachers that are receiving low wages. So we're only able to operate these by sort of continuing the very low wages in the workforce. And in a minute, you'll see what happens when we use a more competitive wage. Similar in homes, we can see that for some providers, depending on their mix of children, they are able to make the business work. But again, home wages are typically even lower than center wages. So home providers, whatever is left at the end of the day is what they take home. And often we'll talk to them and they don't even think about it in terms of that it's income. They're doing this because they'd love to do it, but it's still a business and we still need to support them. So it's like what's left at the end of the day is what they make. So now let's see what happens when we change some of those assumptions about what the provider's business model looks like. So the first one here is that making a business work only works with, again, those low wages, but also lower quality. So higher quality is expensive. It's more expensive. You need more. The main drivers that you need more staff in some cases, you need more staff per quality level, but here in our county, it's driven also by that you need increased wages. There's, according to the quality rating system, there are additional requirements for staff, and it's just overall more expensive. But tuition doesn't change as much, so parents aren't able to afford necessarily a level 5 center. So providers aren't necessarily able to charge as much more as they would like to run a higher quality center. But of course, we know that a high quality is really important for kids, for their long-term benefits, and for the economic benefits also of the community. So now let's look at what happens when, instead of that market tuition rate that parents are paying, providers receive more children receive subsidies. So now you can see, because the subsidies are greater when you're at higher quality, now the business model works. So now you're actually incentivized as a provider to have higher quality. Your business will work better. The problem, of course, is that only a small percentage of families in the county are able to receive subsidy, even though more are eligible. Again, so we want, in order to make the business model work, more children receiving subsidy means both it's good for the kids, but it's also good for the family, for the providers, because they're able to make their businesses work and provide high quality. And then the final comparison here is the age mix of the families who are part of the center. So if you're running the green bars are in this theoretical classroom. This goes back to the current wages. It's not the wages we might want to pay. It's the current wages. If you have a site that only has preschoolers, you can probably make it work. However, this is not how providers actually work, because they serve the community in most cases. And so the infants and toddlers, the little kids, they're very expensive. And so if you had a site that's the blue bar with only infants and toddlers, you it's impossible basically to run your site. So what happens is that the preschoolers are subsidizing the cost of the infants and toddlers. So preschool has to be charged a little bit more because families simply can't pay what it really costs to send their baby or their toddler to care. And finally, there's one more comparison, and this is the wage comparison. So again, the dark blue are the current market wages, and we can see again that as quality goes up, it's harder to make the site go. But if we paid, but again, this is because of the low wages among the workforce. So if we paid a more competitive wage, in this example, it's a comparison with what a school district, this is the Montgomery County school's actual wage for a lead teacher. So we can see if we paid something like that, then you really can't make your site work. So yeah, so again, it's the low wages that are enabling providers to stay in business. So again, some of these key findings: high quality care costs more. We find that all over the country. It's true here as it is everywhere. So the county and state subsidies and the EquiCare grants, they generally incentivize high quality care. So they do enable providers to provide more care and to increase their quality level. But in order to do that, the providers have to enroll a large proportion of children receiving subsidies, which obviously means there has to be enough subsidy funding available for all those eligible parents to receive those benefits. In terms of age, infant and toddler care is very expensive. It's more to deliver, it costs more than for older children. Providers have financial incentives to enroll more older kids who, again, offset the cost for those younger children. And if you do receive state subsidies, then those can equal or exceed the modeled cost of care and make your business model work. But again, participation in these programs is limited. In terms of costs and wages, businesses are sustainable because these wages are low. And again, parity with school district rate wages means that you have a negative net revenue. So you're losing money as a provider at all quality levels, but especially at higher quality levels. Our recommendations based on these findings include first, expanding access to local child care subsidies and grants. So by increasing program funding, you can raise the number of children who are receiving support, especially those infants and toddlers. We also found in some of our conversations that there's some administrative issues with families and providers in navigating the system. So doing anything possible to ensure that they are enrolled in a timely way and are paid in a timely way and stay in the program. So in some cases, we find that children come in and out of the program. So that makes the business model work for providers when they know they have a child in the seat for the whole year. And we want, in addition to the funding, the recommendation is to support increased participation among those families who are eligible by helping them get in the program, information, expanding outreach. In terms of child care professionals, our recommendation is to support providers in increasing wages. One way to do that is to increase the child care subsidies for those providers who pay more. There's different ways that that counties and states have done this before. So there's different models for how you can identify what the amount should be for providers that are for teachers and how much they should be paid. We want to ideally prioritize the providers who enroll a large proportion of subsidy eligible children because this makes their business model work. It also is targeting the families of highest need in the county. And again, a local salary scale of what a competitive wage with respect to the actual economics and workforce in the county is very important.
Thank you. So now that we've reviewed the findings, I'd like to underscore just a few takeaways that we want to elevate for discussion. The first one, the supply and demand study. There exists significant childcare shortages, especially with infant toddlers, as you've seen. Currently, only 19% of the infant and toddler demand is being met. Close to 18,000 additional seats would be needed to achieve full coverage, underscoring the need for expansion and investment. The second takeaway from the supply and demand is that barriers continue to persist in accessing childcare as well as participating in subsidy. For many eligible families and providers struggling to access childcare subsidies, we have to take note that only 17% of the over 30,000 eligible seats are currently being used. That's very drastic. This highlights the needs for improved communication and support to boost participation. From our cost of quality childcare study, we now have data to reinforce insights that we've long understood. The first is that higher quality care is more expensive. High quality childcare is expensive due to the staffing and low ratios. Only 26% of county programs are currently at levels 3 through 5 in Maryland Excels, our quality rating improvement system. And despite incentives for enrolling more subsidized childcare and receiving a higher tiered reimbursement, low participation in higher tiers continues to be a financial barrier and need for greater investment. Another striking takeaway is our infant and toddler care costs more. Many childcare providers are financially incentivized to prioritize older children through preschool-focused grants and funding sources to offset the higher costs of infant and toddler care. However, lessons learned from other jurisdictions, this shift converts the availability of infant seats, effectively cannibalizing the childcare system by reallocating resources meant for younger children to older age groups. And the last one is sustainability issues are directly tied to wages. The financial sustainability of childcare programs often hinges on paying relatively low wages. However, achieving parity with public school wages would basically tank the programs and threaten their sustainability. However, I think what is very explicit between both of these studies is and very clear is investing in infant toddler care is critical. These programs have the highest costs but the least amount of funding. Without more financial support, the gap in access to quality childcare will grow, impacting not only school readiness but economic stability in our county, as reliable childcare is essential for parents to remain in the workforce. As the most recent Maryland State of the Economy report highlights, childcare challenges are a significant reason women leave the labor force, emphasizing the need for more investment. Childcare programs are being forced to operate at these lower qualities just to survive. And I think what was elevated through our work group with our stakeholders was a statement that one of our consultants had stated, and I want to share it with you. The harsh reality is that the older children must subsidize the cost of care for the younger children, and unfortunately it is the teachers' low wages that subsidizes the entire system. This business model, which relies on underpaid professionals and cross-subsidization, would be unthinkable in any other industries. So now I welcome questions from council members to our consultants regarding the studies that you had just heard.
Thank you so much, and thank you for moving efficiently. So we have 35 or so minutes, so that's like 6-7 minutes per council member. I'll be less than that to model good behavior. But I just want to emphasize that we do need to move, and the next discussion bleeds into this a little bit too. So just really important data and underscoring, like you said, a lot of the stuff but putting context and actual numbers to what we knew to be true. And just want to emphasize something you said, this whole system is broken, right? Like, it's not our fault it's broken. It's a broken system nationally. Obviously costs here are higher, so it could be more broken here in the sense that it just costs more, but it's broken everywhere. And there are things that we can do, though, to address with the money we have, the resources we have, to make the problem less bad, less broken. But the system is broken. We're going to need massive federal support and state support and local support to make it unbroken. I just want to state that. So the 57,300 children under 5 and only 33,000 seats for the infant and toddler population. That's 1 in 5, 1 seat for every 5 children. We know that the other 4 out of 5 infants and toddlers are being taken care of in informal settings. Did you guys do any work on that at all? I don't think so, but I just want to ask.
Yeah, it came up in our surveys. So that survey I mentioned, we surveyed 249 parents, included both families that are using like formal licensed care, but also families that keep their kids at home, families that are using family, friend, and neighbor, et cetera. And it also came up a little bit in our focus group, although most of our focus group participants were using at least some licensed care as well.
So you clearly have a recommendation, more money, and focus it on. If I had to summarize, with more money, and I'm hearing my former colleague Nancy Navarro, a dedicated funding stream, which she would always say which I agree with, just to say, but it's I think our community would support a dedicated funding stream for early care and education. But if we had such a thing in the perfect world, it seems like you're suggesting, I want you to respond, that it would be focused on 0 to 2 to meet the need. But if you're not suggesting that, let me know.
Right. So I think there are a few different priorities, but we would emphasize the infants and toddlers as a priority area of need.
And are there other places what's a model where that has happened in the way, kind of combining both of your things? Because the thing I love about these both at the same time is you showed kind of the where, also the what. Could we further refine, and are you working with our team to further refine where that would look like and what that would look like in scenarios?
I'll say that there are probably sub-geography, the sub-county, more local look is probably beyond what our results are here. But I would say there is a lot of work that's been done in targeting subsidies in ways like that. So there are different policy and funding approaches that can be used. So that's very interesting to look at.
So we could do it, and you think that would be a useful exercise? Go ahead.
So I think we have the start of a model, which is the EquiCare grants. It is a grant system versus a reimbursement. It does pay at a rate that sustains programs. It is targeted to infants and toddlers in specific areas of the county, jurisdictions in the county. So we have the foundation of a model that we could definitely grow that would look at just that, answering not just the where, but now we have a mechanism to be able to get resources to targeted communities.
Very exciting. I'm going to pause for there. Again, I'm going to model good behavior, and then I'll go to my co-chair, Councilmember Albernas. Thank you for these reports, though. They're really, really helpful.
Thank you. They are. So obviously the biggest expenditure are wages, but can you break out what the expenditures are that are the most significant for providers after wages?
Sure. So wages typically we find are about 80 to 85% of the total costs. In this area, rent, depending if you're a center or a home and what your model is, rent, mortgage is probably, we're happy to, in our report are all the sort of gory details of the model. So facility costs are likely the second most expensive. Providers are different. So food costs can also be expensive, but it really depends a lot on if you're providing food, if you're receiving subsidies through the food program. But I would stress that most of these other costs are they're not unimportant, but relative to the staff costs, they don't make as much difference in making the model work.
Thank you. Where does insurance fall in line?
It's relatively. We do have that included in our model.
Okay.
It's a relatively small expense, though.
That's good.
Yep.
I guess the other area that I'd like to focus on for now, and then I may get back in the queue, is just the geography. I think overlaying where the greatest need is, but where also there's the least capacity, was really interesting. And I guess in terms of affordability, how far are people willing to go or can go to find something that is affordable for them? So in addition to cost, obviously, huge barrier, the most significant by a mile, is the second transportation?
Yeah, it definitely comes up in our conversation. So particularly, those families that are relying on public transit or they have a long commute to where they are working, that's where they're, even more constrained in where they can, how far they can travel to get to, a childcare program that's going to work for them. So in our survey, we have, I'm sorry, I don't have the numbers in front of me, but some estimates about like traveling and commuting and that, but unfortunately didn't put it in the presentation.
That's okay. That's okay. It would also be interesting, I know this wasn't part of the scope, but to see where people are going to for their jobs. How many of them are staying in the county? How many of them are going across the region? And obviously for the families that are working multiple positions, it could be multiple obvious locations. But it just goes back to that transportation issue, so I'd just be curious about that. I'll get back in the queue in a second, but I'll yield back to you, Mr. Chair. I know we got a lot of questions.
Councilmember Sales, if you're ready.
Thank you. And thank you for the very thorough update. This is an issue that has been top of mind. Not sure if you saw the comptroller's annual report where she said that child care affordability and access to quality child care is the number one issue on the minds of employers and our workforce. And so you mentioned the lack of enrollment among families was one of the metrics that stood out the most, and just wanted to find out if there are any efforts underway to increase the participation. Not sure what outreach is looking like.
Participation in
I think you're referring to the subsidy.
Yes.
subsidy
subsidy.
model. Okay. So I think it's important to note that we are looking. I think this study gives us the opportunity to do two things. One is to evaluate the outreach that we are currently doing with our subsidy programs, but also to reimagine what our subsidy program could look like. And looking at, how to make it more accessible to families as well as providers, and streamlining the process. What we do know anecdotally is that, for many, it's quite cumbersome to access subsidy programs. There's a lot of paperwork. So one of the differences that we modeled in our pilot program, the EquiCare, was to really eliminate a lot of the burden of documentation and data and submitting things, and so minimizing to what really is needed for that family. So I think reviewing that, we're committed to reviewing what we've done and taking it the next step. So I think reimagining what it looks like is an important conversation that I know with the ECEI that we want to engage with. And as I said, we are doing, we have a outreach work that happens with locally for Working Parents Assistance Program. We also have family resource specialists that help parents with the state child care scholarship, but more work can be done. The state child care scholarship is, we are supporting it, but it's not our program. I think I look at the work that we do with Working Parents Assistance Program, which is we have, person-to-person support, we have online support, we have various languages, different modalities that you can be able to outreach in the community. Being in the community and having ambassadors out there, that model is really, I think, has been very successful in the past year, which is why we saw such an increase in our Working Parents Assistance Program.
So nothing formal is underway to ensure that we're increasing the amount of people who are enrolling in the subsidy program.
So the outreach that we're doing is that formal approach.
Oh, okay. So we should see some updated information about enrollment next fiscal year?
Yes.
Okay. All right. And I believe Councilmember Jawando asked about this, but I'm not sure if I missed the response. Are other jurisdictions providing infant and toddler care more appropriately, since we're seeing such low enrollment numbers? And are there any strategies?
Actually, no. What we're seeing is the opposite, that many programs are converting their infant seats to preschool seats because of the funding sources that are available. We saw this in our neighbors in DC when they went over to the public preschool program. And so many of the seats were being converted. So we don't see models right now, and I think it's an opportunity for Montgomery County to be very innovative in pushing what we do have right now, which is the EquiCare program.
Yes, and I know capacity is also an issue. Is there any efforts? Are we tracking how many childcare facilities are in the pipeline, or are we incentivizing developers to produce those facilities?
So, we are going to be launching our facilities fund, the $4 million facility fund. Come January, the RFP will be released. And it's a capital improvement project that will be dedicated towards expansion and quality improvement. So that will be the impetus to be able to really grow. And I think that these studies will help us, using this data to help us really target and prioritize where those funding streams will go to help programs expand and improve their quality. Looking at those areas on the map that have the highest unmet needs. And I think that that really will help parents and providers as well as opportunities for children.
Thank you. And if you can share that information, I would love to share it widely with our network.
Sure.
All right. Thank you. Thank you.
Thank you. Councilmember Make.
Thank you. This is great having the data laid out like this and having the maps, and it's all really helpful. So thank you. I just want to make sure that I understand all of it. So I'm going back to the from the supply and demand access to affordable care graph, and just looking at how families with subsidies are only using 10% to 21% of the seats eligible for CCS or WPA, and the need to, as we've been talking about, increase outreach and so on. And I'm balancing that with, and that's for, that includes preschool as well. I'm balancing that with the issue that we're hearing about with the cannibalization of the infant toddler seats. And so how are you thinking about balancing that? Because obviously, the seats are there, the eligible seats are there. We, when we look at the gaps could look worse, certainly, obviously, when it comes to the preschool age seats in terms of the existence of the eligible seats. But of course, if we can't have, if the kids aren't in them, then that's still a gap. But I'm also hearing about this pitfall if we just throw a bunch of money at that, but we're not also attending to the infant seats, then the gap on the infant seat side is going to increase. So we need to be throwing money at all of it. But can you just talk a little bit about how you're thinking about that strategically in your work now?
So I think, there's a couple different pieces to that. I think one is, the outreach, as we talked before, right? There's an outreach component. There's an education that has to happen in the community with providers. Two, I think that from the ECEI's perspective, working with our partners and stakeholders is really looking at what does our current subsidy model look like? What will our facilities fund be? And being able to target those resources. The reality is that we don't have enough funding for everything. We have I'll say a decent balance within preschool, but really significant.
It's very diplomatic.
Very different in the infant toddler scope.
Right.
So I do think that we have to make some decisions about targeting and where we target those funds for infant toddler seats and where those highest unmet needs are. I think that is what are the next steps. And I think that as ECI, we are committed to having an action plan that will really bring those recommendations that were offered by our consultants and a real roadmap on how this will impact what we're doing in Montgomery County.
Are there ways to incentivize providers to keep their infant toddler seats?
Yes.
While we're subsidizing the older kids?
So actually, Jacob had shared with us in Philadelphia, one of the models that they have is that with their preschool programs, that the funding that's awarded is with the assurance that these are actually new seats, that you are not converting any seats. So you don't have a loss. The program doesn't have a loss or conversion. The community doesn't have a loss, and the program is not converting those seats to specifically like pre-K. So it would really truly be an expansion of seats. So that would be something that has really rung true to all of us on our committee, that to be able to have that as a caveat for anything that we do.
That seems like an important
Yes.
element. Okay, great. Thanks for that. And I see that was in Philadelphia?
Correct.
You said in there at the top of the bar chart there.
Yes.
As I'm looking at the supply and demand study also, I'm trying to make sure that I understand which numbers are relate to like the seats that exist and the eligible seats that exist, and as opposed to like children served. Could you talk about that?
Yeah, so most of the numbers you're going to see are basically the total capacity in programs that are participate in these subsidy programs. So they're usually sort of like the capacity. I think the only slide where we look at the actual number using those seats is that first supply slide, where it has the 440. Yeah. So all the other numbers are capacity in programs.
Okay, so that's important for us to keep in mind because we have seeing the maps that relate to who is that show us who is actually in the seats as opposed to where the seats are. Where they are is, I don't want to say it's theoretical because that matters. Those seats are there, right? And it's a different mechanism that we need to make sure we're serving our pre-K community, given that we have those seats there, which is a good thing. But understanding like the gap analysis around who is being served is another layer of this complicated layer cake that we need to include in the conversation as well. And I know that we will in further conversations also. And then looking at that compared to what we have for infants, where we all have this need on both sides, the facilities need, program existence, seats needs, as well as then the participation, which is a whole other bucket of outreach as well. Okay, I will. Actually, I have one other question. Sorry. In the supply and demand study, I think there are 2-year-olds that are lumped in with the preschool kids, and I just wanted to understand. It's just, I'm going to assume that the big takeaways are still what they are, but as we kind of try to get into the nitty gritty of understanding, who we're targeting and with what, that's different than where we see the ages laid out in other places.
Yeah, that's a great point. And partly that had to do with some data limitations. So, one of the challenges we had is the data we got from the state about capacity, which is, kind of the bedrock of our supply estimates, includes like all ranges of age. Many child care providers, they serve school-age kids, 6-year-olds, kindergarten, after school. But we in this study tried to hone in just on kids being served, that were under the age of 5, because that's really the child care age. And so we had to make some estimates there. We were able to get numbers from the state about capacity for infants and toddlers. And then we used our sort of survey data to figure out how many of the kids that are left over were in the sort of child care age. And so
infants and toddlers was
under 2.
Under 2.
Yeah.
As opposed to like birth to 2.
That's right. So our data wasn't quite precise enough to break out like year by year capacity numbers. And so that's unfortunately why we had to kind of lump those 2-year-olds in. But as you saw in the business model, 2-year-olds are a little different than 3 and 4 and 5.
Right. And then in terms of our, the blueprint requirements, which we all acknowledge that there's that's its own separate mess. But like down the road, these are problems we're trying to solve all these problems, and we're going to need to kind of figure out how to break down the data in order to have what's going to be a long-term strategy here to address the needs at all the different age levels. And so just noting that as we kind of compare data sets here, that's a wonky bit where there's a little bit of a difference. Thanks.
Thank you, Councilmember Lukey.
Thank you, and my apologies for my late arrival. I had another matter to tend to. I know we've discussed both the facilities challenge and the dollars and cents challenges applicable to that 0 to 2-year-old group, right? Because many child care facilities, you've got your 0 to 6 room, you've got your 6 to 12-month room, you've got your 12 to 18-month room, then the 18 to 24, and then when they hit that 2-year-old room, they start to think they're really moving up in the food chain, and they're getting excited because they're getting closer to where the bigger kids are. But there is a math to all of that, in addition to the regulatory requirements that are so much higher for that 0 to 2-year-old population. And understanding we're trying to do seat creation in all directions at all ages, because the goal is to not have so many people have to leave the workforce who don't want to leave the workforce. It's one thing if you're choosing to. It's an entirely different thing when you're forced to, because you absolutely cannot find childcare. And yet we have significant challenges and when I say we, I mean as the government attempting to assist private entities and care providers with expanding, particularly in the 0 to 2 area, because we're not going to get the staffing ratios aren't going to change. And therefore the space allocations necessary for housing those children within those facilities isn't going to change. What would it take, and where do you see the department's role or us as the funding body, our role in helping within that ecosystem where, of course, there are all these other variables of public or private financing and business operations that are at play?
Since you said on the department's role. So good question. I think that as a department, HHS has a responsibility. I see childcare as a public good.
Right.
And so where our efforts are going to lie. Can we respond to it all? No.
Right.
But I do think that we have the mechanisms to be able to, A, share the information. So we've done the research, share the information with our stakeholders. I think B is to utilize our public dollars for public childcare seats, right, in a way that will respond to the data that we're seeing from both of these studies. Leverage the dollars that we have in a more targeted way. I think that I think there's a piece to this also that childcare is a business model, right? And is privately owned, and so there are what makes it, I think, more of an unusual sort of thing is that the amount of regulations that dictate what they can and cannot do and how they do it.
Right.
In terms of infant and toddler care, I think that we have the opportunity to be able to really leverage our public dollars in specific areas. So that's what I see our role doing, is where is the county going to be leveraging our dollars and where are we going to be planting those seeds so that we can really benefit the community. I think for the larger community, they utilize this information when they're making their decisions.
Right.
We do have business supports in which we help programs open up.
Right.
So we have a business counselor, so guiding them also where in the county to start their businesses, where they can access, whether it's SBA loans or if they're going to use the facilities fund or if they're going to use other type of funding streams. To be able to create their businesses. So I think that we have that opportunity to be able to expand on that and really prioritize what it is that we are doing.
Okay. And then and this came up during our budget discussions last year, and it's still, I've said many times, I don't have to deal with it anymore. My kids are old enough that I'm not dealing with this, but boy, was it unpleasant. The before care, after care, summer care, when there are programs that are available, but they are half day, or they are 9 to 3, or they are 9 to 3, but only when the public school system is operating and they don't run in the summertime. And this creates a lot of upheaval for parents because it doesn't bear any resemblance to a working family's needs, right? Plus, then it means that the child, especially if before or after care isn't available on site wherever they're receiving their other programming, they're bopping around between multiple places or to a different site during the summertime, which could be fun, but might not be, depending on, the child's individual needs too, where consistency and predictability might be incredibly important given that child's unique circumstances. So what are we doing? What are we, the county, what are we doing to help incentivize the programming that is more directly correlated to working family needs for their children?
I think one of the things that has come up over the past year and a half too is, for example, with Blueprint, that is a 6.5-hour day, 180 school days, and there's there's holiday breaks, there's
Right.
teacher development, there's summer, right? And those children, where are they going? We also see it in some Head Start programs, right, where the children are at school, and then after school, where are they going between, before 9 and after 3? And so being able to educate the community in terms of what different modelings are of offering your services. I do think that we can improve in that sense. It really was, for most of those select before and after, right, that is a school age related
Right.
childcare
Right.
dilemma for families, right?
Right.
And our work has really been centered in birth to 5, but we're seeing that now, as I said, with the Blueprint and Head Start. So, I think that part of the work that we do is just that, responding to what do other business models look like so that you can sustain that. What we also found, and I think another piece to that conversation, is looking at what's happened after the pandemic, where many families now who are they're teleworking, and
Right.
so they're home based, they're working from home, and so the child, they don't necessarily need 5 days a week, they need 2 days a week, or they need 3 mornings, or it's just these combinations. We see a lot of success in creative enrollment in family childcare versus
Right.
center-based programs.
Right.
In centers, if someone is there in the morning, it doesn't matter if you're not there in the afternoon, the child, because you still need that staff person, so you're still filling a
Correct.
full day. So I think that there could be some improvements on how we craft the support for that, but also looking, again, going back to our Working Parents Assistance Program is a really good
Right.
model that does do part day, part year school vouchers. Child care scholarships has a component of that as well. But as we reimagine what our subsidy programs look, can we elevate that piece of the conversation in there as well?
Right. Great. Thank you.
Thank you, and want to appreciate Councilmember Fanny Gonzalez joining this joint committee, and turn to her.
Thank you so much to both co-chairs, Councilmember Arbonos and Yawondo, for hosting this event, and to all of you for all your work on this highly important issue. The childcare industry is a very special one that must have government intervention on funding. We tried to do that at the federal level with Build Back Better. He died. He's not coming back in the next 4 years. I had to take that off my chest. Before I work, because my questions are really on workforce, and that's kind of starting the next 5 minutes. But besides that, on this particular item, I'm still not clear from you. What is the timeline? Because we're thinking about reimagining childcare. These are all the things that we're thinking of, and we're thinking of Philadelphia. We're doing this and that. I need concrete answer. This is when we're gonna have a draft for you all to consider for the next step of childhood education in Montgomery County based on A, B, and C. When is that happening? Are you bringing it to us before the budget? Is it included in the upcoming budget from the county executive draft? What's going on there? Because I haven't heard any of that.
So our final report is going to be released to the public from both studies in January. We are also going to be gathering a group to work on next steps, which would include specifically expansion of childcare, public childcare options, reimagining the subsidy program, steps to strengthen our current existing supports and redirecting resources, and enacting subsidy formulas that align with financial support that are true costs of care, not market rate. And the goal for us is that we do that by the end of this fiscal year. So by June, we want to have that all finalized.
Okay, but everything that we do regarding childcare has direct impact with the blueprint as well at the state level. If you're telling me that you're going to have the report in January when the General Assembly is kicking off, I was assuming that you were going to have recommendations to change at the state level that we can push for. January is way too late.
So we are already working with partners. Montgomery Moving Forward, who will be in the second session, we'll be talking about the recommendations and the advocacy work that's happening at the state in terms specifically to workforce. In terms of blueprint, the big barrier there is the workforce. And
Yes.
we'll have that conversation in the next session.
Okay. So that you're going to connect the workforce conversation with the state regulations
Correct,
in this report that you're having in January, because I need to see everything in one.
So with
Document.
the workforce, so our focus really was on the supply and demand and the cost of care, and what are the supports we can give to our actual providers and our families for accessing childcare.
Yes.
So it is not only the subsidies, right, that exist, but any potential grants, reimagining what that looks like, streamlining those processes so that we can have faster input into the system, as well as growing the capacity. The workforce piece is a conversation that is parallel to that, but we want to get moving on getting children into, as the council has said in the past, children into seats.
Okay, I'm ready to move on for the next step.
I appreciate that. I think we have a couple more minutes. I will say this is 2 of 3 studies. I know we don't
Yes.
have the third yet.
Yes.
We are eagerly awaiting the third.
You want a little brief now?
Yeah,
Or
tell-
so
tell
the
me what the
study,
timeline is
the
on
workforce and compensation study has been awarded. School Readiness Consulting has started the work. And so they have between 7 to 9 months to complete the entire study. And there will be a presentation. There will be initial analysis that we can share in the spring. There'll be a final report within that 7 to 9 months.
Okay. All right. Well, I'm glad we have 2 of the 3. We were supposed to have all 3, but we're moving. That's good. It's been awarded.
Yes.
Quickly, Councilmember Mink, before we move on.
Yeah, just wanted to circle back and note that on the conversation we were having before around the gap analysis, the difference between seats existing and butts and seats, it would be great to get like maps that look like these, but that are about the gap between who's being served and the needs, if that makes sense. So we're looking at in the supply and demand, like where there are shortages in terms of the seats existing, but what are the gaps between the population and the number of families who are able to have their kids be sitting in a seat in these different areas, whether that is because we need more outreach, more funding, that's the needs are obviously different, as we've just talked about, whether we're looking at the infants versus the preschool, but that would be helpful.
So that would be like a map of within each part of the county, how many kids are eligible to participate in a subsidy program and how many seats are there in subsidy programs.
And how many of those kids are in a seat?
Yeah, we definitely can do the first one. I think it actually is already in the report, but we'll make sure we elevate it. Unfortunately, we don't have access to data right now about, individual kids enrolled in different places. Because, there's privacy concerns with that. But I think we could probably work and figure something out to.
That'd be great.
to
And
give you
some of it
something
might
on
be,
Yep.
approximate. If we've got these number of kids in this, census tract and this number of kids who are in, this age level of infant seats, toddler seats, preschool seats, and so on. And then we can overlay that with these maps to say, like, we know the problem in this area is not that the programs don't exist. It's with the connecting or whatever, and so on. Thanks.
Yeah, that's a great point. And just before we close this one out, so Ms. Yao brought up this question. I kind of alluded to it earlier. Is achieving universal pre-kindergarten the most pressing need for families? We kind of danced around this. Sounds like maybe no. The thing that appeals about that is what DC did is like you try to accomplish something. You get 4-year-olds, and there's more funding for that. But obviously, we know there's great needs 0 to 2. Do you have a theory on that? Is that part of what you're going to come back to Councilmember Fanny Gonzalez's point of like what our approach? Because we can't do it all. So what do we want to focus on? Do you have a sense of what you're thinking right now?
2 pieces. I think one was putting caveats to anything that relates to preschool programming, that it is truly expansion, not conversion. And 2 is that really
By that
targeting.
you mean not just part-time, full-time, but
Full-time.
more seats.
More seats.
Yeah.
And then in terms of expansion is focusing on the infant toddler, because based on what we've seen, that there is a decent number of preschool available funding sources, right? Whether that is preschool, Head Starts, excuse me, early Head Start also actually is a birth to 5 continuum that is available out in the community. But infant toddler is where the real, I believe, is the real need at this point.
Okay, so I agree with you. I just want to like be clear so we can
Yes.
understand what our goals are. So we want to impact infant toddler. That's the big
Correct.
need. It's only 19% of the capacity. We know all the stuff we know from science about words and brain development in those years, so it's consistent with that. Okay, great. Now we just need to have the plan to do it. All right. So with that high note, we will close this, we will adjourn this session, and then Councilmember Alvarez will pick us up for the next one.
Thank you. And in a moment, I'm going to turn over to Councilmember